Hello, my name is Sarah Tolchin, and I am proud to be introducing my best friend, Summer King. Summer is a 12-year-old sixth-year student in Alan Becker's classroom. She has been attending First Montessori for 11 years. Summer will be covering breast cancer for her sixth-year project. And now here's Summer.
As you previously heard, my name is Summer King, and I will be covering breast cancer for my sixth-year project. 40,460 women die of breast cancer in the United States each year. Once I found this out, the fact that my best friend's mom had breast cancer was even scarier to me. Our families are really close, so I got to spend a lot of time distracting my friend from her mom's cancer. Although it's sad to think that before my best friend's mom got breast cancer, I barely even knew that it existed. But doing this report has really opened my eyes to see that so many other people are suffering from the same disease each year. Knowing this, I really wanted to do something to help, but I knew that I needed to learn a little bit more about it before I could actually help. So I decided to research breast cancer for my sixth-year project. I will be covering what breast cancer is, what causes breast cancer, how it is diagnosed, who can get it, the different stages, and its treatments. I hope you enjoy my sixth-year presentation. Breast cancer starts when a healthy body makes cells as needed, but then keeps producing until there are too many. Then these extra cells come together to form a tumor. There are two types of breast cancer, non-invasive and invasive. Non-invasive breast cancer is when the cancer stays within the patient's breast region. Invasive breast cancer is when the cancer spreads outside of the patient's breast region and goes to the lymph nodes underneath their arm. All of the exact causes of breast cancer are not yet found, but here are 4 possible causes that have been discovered so far. The first possible cause is that chemicals in the form of gases come off from factories, farms, and houses and pollute the air that we breathe. I have an example of this on the screen. Another cause is heredity. Heredity is when the cancer is spread through the genes in the patient's family from generation to generation. A third possible cause is radiation. Radiation is a threat when radioactive particles are sent from radioactive substances like our everyday microwave. And now the fourth possible cause, your diet. Your diet can be a possible cause of breast cancer when it's extremely high in fat. Researchers believe that there is not one cause of breast cancer, but multiple that interact with each other. There are 3 steps into being fully diagnosed for breast cancer. The first step is to be screened. It's important to be screened for breast cancer at the earliest possible opportunity. There are 3 ways to be screened for breast cancer. The first way is by self-exam. A self-exam is when the patient feels for a bump right above the breast region. The bump would be a tumor. The second way is a clinical exam. A clinical exam is the same as a self-exam, except doctors and physicians do it in a clinical setting. And now the third way. The third way is by mammogram. A mammogram is a low-dose x-ray that is good for finding tumors that are too small to be felt. After you've been screened for breast cancer, if a doctor sees a threat such as a tumor, you will send to have a sample of your tumor taken out. This is called the biopsy. There are 5 ways to have a biopsy done. The first way is a fine needle biopsy. This is where doctors take a fine needle and stick it directly into the location of the patient's tumor. The second biopsy is an incisional cut biopsy. This is when doctors remove a large piece from the patient's tumor. The third biopsy is a core needle biopsy. This is when doctors use a mammogram to direct their weight to a certain location in the patient's tumor. The fourth way is an excisional cut biopsy. An excisional cut biopsy is when doctors quickly remove the patient's entire tumor. The fifth biopsy is a localization biopsy. A localization biopsy is when doctors use a mammogram to locate the patient's tumor and then stick the area with the fine needle. Then the biopsy will be sent to a pathologist. A pathologist is a doctor that studies the biopsy to see the amounts of cells, see if there are too many or too little. An interesting fact is that anyone can get breast cancer, although it's most common in women than men. 40,460 women die of breast cancer in the United States each year, compared to 400 men that die of breast cancer in the United States each year. Some men are embarrassed to get treated for breast cancer because they believe it's a woman's disease. Your chances of getting breast cancer increase with age. For example, at the age of 25, your chances are 1 in 14,985. Compare when you're 25 to when you're 50. When you're 50, your chances are 1 in 54. There are a number of stages for breast cancer, and it's important for doctors to identify the patient's stage as soon as possible so they can decide the treatment plan. Staging tells the patient how much cancer they actually have. There are 6 stages. Stage 0, which is when the cancer is still within the patient's mammary ducts. Stage 1, which is when the patient's tumor size is 3/4 of an inch. Stage 2, which is when the patient's tumor size is larger than 2 centimeters and smaller than 5 centimeters. Stage 3A, which is when the tumor size is over 5 centimeters and the cancer has spread to the lymph nodes underneath the patient's arm. Then there's stage 3B, which is when the cancer has spread to the patient's skin, chest wall, or breastbone. Now stage 4. Stage 4 is when the tumor carries the cancer cells to the patient's bones, liver, lungs, or possibly even their brain. Once your stage of cancer has been diagnosed, doctors will determine your treatment plan. This will include surgery, chemotherapy, and/or radiation. There are 2 types of surgeries, lumpectomy and a mastectomy. A lumpectomy is when doctors remove the patient's malignant tumor, malignant meaning cancerous. A mastectomy is when doctors remove the patient's entire breast. Chemotherapy. Chemotherapy can last from 1 to 6 hours and is given through an IV or drugs. An IV is a needle that leads directly to a patient's vein and is given in a clinical setting. Chemotherapy was designed to kill all multiplying cells because cancer is a multiplying cell. But when cancer is administered into the patient's body, it not only kills your multiplying cancer cells, but your multiplying hair cells as well. This results in hair loss. Here are some side effects for chemotherapy. Nausea, your food will lose its taste, you won't be very hungry, and you'll be very vulnerable to infections. The last form of treatment is radiation. Radiation can last from 1 to 2 minutes and is given 5 to 7 times a week. Usually, the first time a patient will receive radiation is either right before or right after surgery. Radiation is a high-power X-ray that damages cells in one specific area at a time. The side effects may include fatigue, irritated skin, dry skin, and radiation burn. Radiation burn is when the area that receives radiation is extremely sunburned. I would like to dedicate my project to my best friend's mom and hope that one day she gets better. I learned so much throughout my report. For example, that the air we breathe can be a possible cause for breast cancer. I also learned how low the chances were for getting breast cancer at the age of 25. I hope that my project made you more aware of breast cancer, but that you enjoyed it as well. I would like to thank my parents and my brother Eli for helping me practice at home, and I would also like to thank my teachers Ellen and Sarah for helping me with the details of my report, and Roseanne for being by my side every step of the way. I am very thankful for Sarah Tolchin introducing me, and for my fellow 6-year students for those long and hard days of getting everything just right.